According to the data from the Children's Hospital Association, there were more than 47,000 mental health visits to emergency departments at 38 children's hospitals around the country in the first 3 quarters of 2021, nearly 40% higher than the same period in 2020, and the situation hasn't slowed. Dr. Ariana Hoet joins us now, and she's the clinical director of On Our Sleeves and a pediatric psychologist, and up early to talk with us about this very important issue. So we want to say thank you for that and dive right in, Doctor. First, what should parents know and what are the signs they should look for, especially when we're talking about little children?
So for little children, we're looking for changes in their behavior. They don't yet have the language or knowledge to tell us how they're feeling, so they act it out. You see more tantrums, maybe not listening, kind of those meltdowns. If we get into the elementary school age, you start seeing that disruption in their school. They're not focusing, they're not paying attention, maybe they're not getting along with their teachers or their peers. And so that for the young kids, that's what I'm looking out for.
And so there are experts at children in those younger age ranges when they can't verbally say what they're feeling. There are experts that can help walk them through and process those feelings.
Absolutely. There are experts for those kids that we are worried about that the behavior is constantly showing up and really disrupting their lives. But there's also things we can do at home as a caregiver. We can teach them the emotion words, give them the language to express what they're feeling and label it for them. Like, wow, you just threw that toy car. I think you're really angry right now. And then teach them it's okay. We all feel anger. We just don't throw the car. So instead, let's go take a few breaths. Let's go dance a song. Let's go sing together. And so as caregivers, we can also help the kids learn how to navigate these emotions.
So when I hear you say those things, identify the feeling, how young is too young to be concerned?
Um, for concern purposes, any disruption, right? I mean, if we are seeing every day or most days we're having these meltdowns for long periods of times, there's nothing I can do to calm them or there's nothing I can do to distract them. I want you to look for a professional to help. If it's every now and then, maybe once a day, a few minutes a day, that's more of what we expect for a toddler. And if I can easily calm them and distract them, that's pretty normal for that developmental stage.
Can we talk about more, older children, that elementary, middle school time period? What do parents need to look for there? That just seems to be, from what I can tell from my girlfriends, that's a little more difficult.
Yeah, I mean, these kids are going through a lot of disruptions right now. And so, again, we see emotions in kids can show up more as irritability, anger. Even if it's that they're going through sadness and loneliness, they kind of act out a little bit. But also in that elementary, middle school age, you start seeing that they're withdrawing. Maybe they're not interested in the things that they used to be interested in. They just want to be alone more. Nothing seems fun. School grade starts to drop. So again, that change in the behavior and the expectations that you have for them.
And then can you talk a bit about something that's been in the news, and that's self-harm? And can you talk about how we can talk with our children about that? Because I think sometimes there's reticence because we think it's going to make our children want to do those things.
Yeah, that's a wonderful question. And we know research shows that talking about it does not make them do it. And so it is important to create that space where it is safe to talk about. I'm checking in with you about how you're feeling and checking in. Have you ever had thoughts of hurting yourself? And creating that welcoming space. Listen, don't ask 10 questions back to back. Don't judge or kind of let your emotions show in that moment. Just create that space to listen to what they have to share with you.
So I think it's almost like mom and dad, guardian, grandma, grandpa, we need to take a breath because we feel that rush of emotions ourselves.
Yes, I mean, of course we do, right? There are children, we care so much about them, but we want that communication to feel good to them so that they can come back to us again and again and again. And so sometimes we do have to take that breath, like you're saying, and kind of keep it all inside for a second and create that space where they can talk with us.
And so are there some things we can do, a place we can go, a resource, if we have more questions? Because you've taken us down a road I think people might want to ask other things.
Absolutely. There's so much more that we can do. If you go to honoursleeves.org, there are plenty of resources. They are all free of ways that we can talk with our kids and foster their wellness. Just make sure they're growing healthy and developing well.
Well, we certainly appreciate you helping us to get a foundation this morning. Dr. Ariana Hoet from Nationwide Children's Hospital. Have a great day. Thank you so much.
Thank you. Have a good day.
You too.